Okay, so we're just going to give everybody at least a minute to kind of get on and get settled. Okay. Dr. Felton and Dr. Schneider, you guys can see me and hear me? We're all good?
Yeah.
Okay, perfect. We'll just take another minute or so. I can see the participant number increasing, so we'll just give people a little bit of time. Okay, I think it slowed down. Okay, so on behalf of the Epilepsy Foundation of Wisconsin, I just want to welcome Dr. Schneider and Dr. Felton to our first virtual meetup. We appreciate having you on here to discuss COVID-19 and epilepsy. So I just want to let everybody on the call know that we are recording this. You don't need to take any notes. We will be putting this up on our website as well as our Facebook page. We're hoping by early next week, so everybody can look back on that. And to introduce myself, my name is Alicia Thompson. I am the program manager for EFW. I've been with the foundation for almost a year. It's flown by, which has been wonderful. And I'm really excited about that we're starting to do these meetups, especially now with, the world, it's strange right now for everybody. So this is a really great way to just get out some education to our clients and future clients, and anybody really who's dealing with epilepsy or seizures. So I'll just briefly talk about the process for tonight for everybody, and then we can get right into it. So to start off, everybody who has registered that is attending, you are muted and your video is off. You are only able to see and hear us, but that does not mean you can't ask your questions. So on the bottom of the screen, there is a Q&A button, and you can ask your questions through that. We do have a couple of our EFW staff members that are monitoring that. So some of your questions will be answered right there in the chat, while others we can possibly discuss here on the call tonight. The other thing I want to say is, just for the sake of time, not all questions will be answered here this evening, but you can submit your questions to our Connect email, and I'll give that to you guys. And then one of our staff members can also put it, there's a chat button, they can also put it in the chat section. So it is connect@epilepsywisconsin.org. So again, it's connect@epilepsywisconsin.org. And then we just ask any questions that do come through, please keep them general for the sake of time. So without further ado, I think we'll get started. Dr. Elizabeth Felton, if you want to introduce yourself, that would be wonderful.
Sure. Hi, everyone. I'm Elizabeth Felton. I'm an assistant professor at the University of Wisconsin. I am a trained adult neurologist with subspecialty training in epilepsy. So I see mostly epilepsy patients at UW Health. And my interests within epilepsy are the treatment of women with epilepsy, and also the treatment of, the use of the ketogenic diet for epilepsy. So I'm on the adult epilepsy dietary therapy clinic. And I'm also on the advisory board for the Epilepsy Foundation of Wisconsin.
Thank you. Dr. Schneider?
Hi, everyone. I'm Janelle Schneider. I am also an epilepsy trained neurologist, but I see both pediatric and adult patients, and I'm at Freighter Medical College. I see only epilepsy patients, and I have a broad kind of range of interests within epilepsy. And I'm also on the board of the Epilepsy Foundation Wisconsin.
Wonderful. Thank you again both for being here. We appreciate it. So we will just dive right into the questions then. So the first one that is pretty common that we get is, are people with epilepsy at higher risk for getting COVID-19, say than somebody in the general public? And then are they at a greater risk of serious consequences if they do get it? Dr. Felton, if you want to maybe start that one.
Sure. I would say this is probably one of the most common questions that I get in my visits that I'm doing with my patients right now. And in general, most people with epilepsy are not at a higher risk of getting coronavirus or of having complications from it. But there are some exceptions to that. So some people with epilepsy are on certain medications that can affect the immune system. So for example, if they're on steroids or if they're on immunotherapy, those are just two examples. Also, some people with epilepsy may have other medical conditions that could affect their immune system or their respiratory system, which could put them at higher risk of getting or having from coronavirus. But in general, broadly speaking, most epilepsy patients are not at higher risk.
Okay. Dr. Schneider, do you have anything to add to that?
No, I mean, I think that's exactly, I agree that that's a common question for patients to ask. And I think we're at a bit of an advantage being in the United States because we are, you know, doctors in other countries that have experienced what we're experiencing before us are definitely starting to gather data and things like that. And from the data we have so far, there would not be any suggestion that epilepsy in general puts you at higher risk for getting the infection or having more complications if you do contract the infection.
Okay, okay, thank you. So if somebody does contract, how do I word this? Are their seizures likely to increase or be more severe, I guess? Dr. Schneider?
Sure, okay. So in general, there's actually, again, like I said, we're at an advantage where people are starting to look at information about what's happened in other places. Even, you know, specifically looking at neurological complications that are happening in patients who get the COVID-19 virus. And from what information we have so far, there would not seem to be any indication that, you know, there's a significant risk across the board of epilepsy getting worse in the situation of contracting the COVID virus. However, with that being said, you know, there are a proportion of patients with epilepsy who do have a tendency to have seizures more frequently with any type of infection. And that can be anything because we know that for some patients, infection, fevers, things like that can lower the threshold for a seizure to occur. So those are all things to be aware of. And if you're somebody who has had that tendency in the past, it's something to be aware of. And rather than using that information to make you feel scared or vulnerable, use that information to kind of help yourself do the things that you can do to keep yourself healthy, all the things that the CDC has been telling us to do, which we should all be doing. But you do have, you know, those tools available to you, hand washing, the social distancing, all of those things are really important to protect yourself.
Yeah,
definitely. Dr. Felton, do you have anything to add to that?
No, I completely agree with that response.
And I would just add, I didn't say, but I would just add too, you know, if you're someone who has the tendency for increased seizures in the setting of infection, just to make sure that you have your rescue medicine on hand.
Yeah, that's important.
Yep.
So with, you know, the social distancing being such a big thing now, and seizure first aid really being hands-on, does somebody who, you know, has epilepsy, has a seizure, do they need to take extra precautions or care if they end up having a seizure? Dr. Felton, if you want to go ahead.
Yeah, sure. So I would say that, you know, of course, we want to do all the things that we can do to prevent seizures. That would be the most important thing to do, right? You know, the making sure you're taking your medications, minimizing stress as much as possible, getting good sleep. But seizures can be unpredictable, come up, you know, anytime for, you know, reasons that sometimes we don't really understand. And if somebody has a seizure, particularly a generalized tonic-clonic seizure, you know, we want people around us to be able to administer seizure first aid. It's you know, it's an emergency, and you want people around you to know what to do when that happens. And so, in this, you know, setting of social distancing with, making sure that anyone that you might live with knows seizure first aid. If you're not sure about that, the Epilepsy Foundation has some information about that on the website, or you can ask your neurology provider what they recommend. But there's not a lot that we can do to mitigate for some hands-on care in the setting of a generalized tonic-clonic seizure.
Yeah, thank you. Dr. Schneider, do you have anything to add?
No, I would just say, one thing that maybe helps us all feel a little bit better about this is the fact that we're all supposed to be social distancing. So most of us are at home, we're, with our family members or loved ones or caregivers. So I think in this situation, less of us are out in public, so maybe less of need to worry about that situation happening.
Yes, that's very true. Very true. Thank you. Another question that we have, are there any issues with most common seizure medications and COVID-19? Dr. Schneider?
Okay, so actually, there is, again, us being at the advantage of being kind of on a little bit behind everybody else as far as when this all started happening. There is a group overseas that started to look at this a little bit, and there's really nothing definitive to say, except that maybe there's some indication that some of the medications that we all know, the seizure medicines that we all know, or your doctors know if you want to talk to them about it. Some of the older seizure medications we know are a little bit more prone to things like medication interactions and things like that. So not unexpectedly, those are things that need to be considered. I would say, if you're in a situation where you're in an emergency room, you're in a hospital, those are all things that automatically are going to be monitored by the pharmacy and the physicians taking care of you. And as far as your daily seizure medications, there's really no change. You're not going to be treating yourself with any kind of medication at home for the COVID virus.
Right. Dr. Felton?
I agree with that. And, just making sure to continue taking your medications throughout this. And if you were to get coronavirus and were feeling not feeling well, so if you're in the hospital situation, they'll make sure to give you the medications, but most people actually don't need to be hospitalized and are able to get at home. But if you're not feeling well, you still want to make sure that you're taking your anti-seizure medications during that time. And if you're having trouble doing that, to contact your neurology provider to discuss, to sort of figure out a plan for that.
Yeah, definitely. So since we're talking about medications, and I don't know how it was for everybody else, but where I live, like in the grocery store, people, were buying things that they, normally don't stock up on. So when it comes to anti-seizure meds, should people be stockpiling them? What are your thoughts on that, Dr. Felton?
So in general, I don't recommend stockpiling medications. That being said, I do recommend, if you're able to get a 90-day supply of your medication. So sometimes the prescriptions are written for 1 month, sometimes for 90 days. And sometimes there are differences in insurances in terms of their willingness to cover a 90-day supply. But if you're able to get a 90-day supply, I would try to request that for two reasons. One, that you have a full 3 months with you at home. And that also decreases the number of times that you may need to go in person to the pharmacy or wherever you get your medication. So in the spirit of social distancing, home will kind of decrease the number of trips that you need to do for that. I do know that I've gotten some communications from some insurance companies that they are allowing people to get refills, earlier than they typically, allow. And that they are, some of these insurances that typically would only allow you to get 1 month to get 90 days. The problem with this when, people are sort of, quote unquote, stockpiling medications is that can lead to medication shortages for others. That's why we want to be careful about that. But I definitely think having your current seizure medications available, and especially if you have a rescue medication, to have that on hand at home.
Yes, that's great. Dr. Schneider, do you have anything to add for the anti-seizure meds, stockpiling them?
No, just to reiterate, it's not about stockpiling. It's about being prepared and minimizing the number of times you have to leave your house or make a trip out. And if it's reassuring, I would say I have not had any patient tell me that they're having any issue with supply since this all started. And would just reiterate that I have definitely had patients that have been able to get a 90-day supply that weren't previously. So it's definitely worth asking the question.
Yeah, that's great.
The last comment, sorry, I just thought one other thing popped into my mind on that is many pharmacies will do mail order. They'll send you the prescriptions to the mail, and so that may be something to look into if you weren't doing that before, to see if you can get it mailed to you again in the spirit of having less trips in person to the pharmacy.
Okay, and you said they can contact the pharmacy. Is that what you do? Correct?
Exactly right. I would contact your pharmacy, and sometimes if the pharmacy that you're currently going to can't do that, you may have to do a different one, or some insurances contract through sort of bigger mail order pharmacies, or, sort of national.
Okay, no, that's really great. That's wonderful. Thank you. I know before we hopped on this, we kind of talked about doctor's appointments, but a couple questions that we have. So if someone has a seizure, should they still go to the ER? So we'll start with that one. Dr. Felton, if you want to go ahead. Sure.
So if somebody has a seizure, it depends on whether or not they need to go to the ER. So if I typically guide my patients that if the seizure is lasting longer than 5 minutes and not stopping, particularly if rescue medication is administered and it's still going on, or if there is an injury with the seizure, or if there are multiple seizures, then those would be situations where you want to go to the ER. Many seizures, even generalized tonic-clonic seizures, can be treated without having to go to the emergency room. So if it's shorter in duration, if it stops, if you're returning to baseline, those would often be situations when you can just contact your neurology provider to let them know that you have had the seizure, what the circumstances were, and then a determination can be made on whether you need additional treatment or something like that. But, I don't want people going to the ER when they don't need to, because the ERs may have a lot of people with coronavirus. But by the same token, I don't want people to be afraid to go to the emergency room when they really need to go. And
Right.
So if you're not sure about when your own neurology provider would want you to go to the doctor, you should probably clarify that. I try to be clear with my patients about the circumstances I would want them to do that. And if you're not sure, this would be a good time to check in with them to see what they think about that.
Yeah, that's great. Dr. Schneider, do you have anything to add to that?
Not really. Just, if you don't feel like if you think about yourself and you're thinking, I'm not really sure what would be an emergency for me, just ask, because it's important information to have. And like she said, most of the time you don't need to go to the ER, but there are times that you do. And so if you don't feel comfortable with what that situation would be, just ask your doctor.
Definitely, yeah. We had a question come in that is asking, what if the pharmacist will only give you 1 month's worth? So Dr. Felton, I think you touched on that you possibly could go to another pharmacy. I just want to verify, this answer.
So usually, if you go to the pharmacy and they say you can only have 1 month, that could be for a couple reasons. One could be that the prescription was not written for a 90-day supply. So you may need to ask your doctor or neurology provider to write it for 90 days. The other reason is that it could be that the insurance will only allow a 1 month supply. So you may need to clarify with the pharmacist what the reason is. They may be able to let you know, and then you would know what the next step is, either asking your doctor for a 90-day supply or calling your insurance to see if they would allow a 90-day supply.
Okay, great. Thank you for answering that. Dr. Schneider, do you have anything to add to that question?
Well, I just had a similar situation with a patient yesterday during a visit where they were given some kind of vague response from the pharmacist about how they could or couldn't fill their prescription. And so since they didn't have much information, it was hard for me to understand exactly what the problem was. So I would say to get the situation resolved as quickly as you can, if you can get specific information from the pharmacist about why it is they're telling you you can only have a 30-day, Is it because the way the prescription was written? Is it because of an insurance restriction? Because then when you call your neurologist office, they can help you navigate the next steps to get that resolved. Otherwise, usually my nurse, if we don't know, she'll call the pharmacy to get clarification. But the more specific info you can get from the pharmacist, then we can help you fix it faster.
Yeah, that's great. So another question about appointments. Again, we kind of touched base before we hopped on here, but if somebody has a doctor's appointment scheduled, should they still be going to that doctor's appointment? Dr. Schneider, if you want to go ahead.
Sure. So I think in general, for the most part, every healthcare system around the country is coming on board with the fact that most routine care right now can be done in the form of a phone visit or a video visit. Now, there may be exceptions to that, especially if you're someone that's getting some kind of a procedure, or for epilepsy patients, I think about things like VNS or RNS programming. So those are things that require a visit, and your doctor's office can work with you on the best way to do that. But in general, I think most of the time visits can be handled virtually, especially right now. And I think you'll find that most offices are going to convert you to that, even without you having to ask. But if you do have a face-to-face encounter coming up and you're wondering if that's something that's really necessary, just reach out and ask. And I would say, given that we're all being asked to socially distance, if your provider tells you it's not essential for you to actually come to the office face-to-face, then just see if you can't, set up a phone visit or a video visit.
Yeah, thank you. Dr. Felton?
Yeah, I mean, most of my appointments now are being converted to telemedicine, where it's a phone visit, and we may be moving to video visits soon. And it's actually working out great. We're able to connect over the phone. We're able to make adjustments to medication. We can actually make a lot of progress with that phone visit. I think that, just checking in, so I had some patients that just sort of canceled, assuming that we would have to be in person, but I would definitely not cancel any appointments, at least call to see what they're doing. At our clinic, there's so many that have to be rescheduled. They're only able to do it right now a week at a time. So somebody who's scheduled 2 weeks out may not have gotten a call about this yet, but will be eventually converted to a telemedicine visit. So if you're not sure, just call and see if that's an option.
Yeah, that's great. We just had a question come through. So if somebody has a scheduled routine EEG, is that something you guys would consider that they should not postpone, that they should go in for? Dr. Felton, if you want to go ahead.
Sure. So we are actually rescheduling or canceling most routine EEGs. There are some exceptions to that. So if the ordering provider feels that it's very important that the EEG gets done for whatever reason, then we will do it. But if it's just for, patient thinking about coming off of medication, we might want to get a baseline EEG or something. I'm just sort of throwing out an example, but something that's maybe not urgent, that most likely will be rescheduled.
Okay. Dr. Schneider, do you have anything to add to that one?
We are also following that same process. It's really up to the physician who ordered the EEG, whether they think it's urgent enough to warrant doing right now. So most of them we aren't doing, but there's definitely some that need to be done. So.
Right, that makes sense. Okay, great. So with many of us, being quarantined, we keep talking about social distancing, and it's a very strange time for everybody. People are not in their normal routines. They're not seeing people face to face like they normally would. So somebody who maybe has epilepsy, is dealing with seizures, and they possibly live alone. What can they do to kind of help themselves or stay connected with their family? Do you guys have any suggestions for those individuals? Dr. Felton, if you want to go ahead.
Sure. So I would say, forums like this, so virtual support groups, Zoom, which is the platform being used here, and there's many other platforms like this that you could get together with your own group of friends, or I know support groups that on pause right now. You could maybe get together with some of those people this way. I it's great to stay connected. I think social connection is for us as humans, and it can be very difficult when you're having to stay home, and particularly if you're home alone. So I really encourage that very much. I also encourage not being too obsessed with the news, because that can get scary. And I think that, trying to be a little bit more in a less stressed mindset is important. And then the third thing I'll just mention, thinking more about seizures and somebody who's living alone, that you may want to have like a buddy system with somebody where you say, I'm going to check in with you a couple times a day or something like that. Just if you're afraid that, okay, well, what if I when I'm alone at home and nobody is going to know that? So having some sort of check-in you do with a family member or a friend or a colleague or something like that may be helpful.
Yeah, that's really great. Especially like you said, with the technology, checking in can be easily done just to make sure, everybody is staying connected. Dr. Schneider, do you have anything to add?
Well, I love all of that. I do have a couple of other thoughts. So the technology is awesome. We're so fortunate for that right now. If you don't have access to technology, there is, of course, always the old phone. So, just using a regular phone to pick somebody up and hear their voice can sometimes be comforting and reassuring. I would also say, I know for myself, with being kind of in the house during this time, sometimes even just going out for a walk and getting some fresh air kind of alleviates that feeling of being cooped up or isolated. So even if you can just get out and get some fresh air, sometimes I think that can be helpful too, to help with your mood and feeling a little bit less constrained. Other thoughts, I always tell my patients to try to focus on the things you can control and not the things you can't control, because I think that helps us all feel better. So we all know there are things we can do to help ourselves through this situation. The hand washing, the social isolation, tell yourself it's something you're doing for the better good of yourself and everybody else, and try not to worry so much about those things outside of your control. I think those are all good tools to use when you're feeling down or isolated. And then lastly, just throwing out, of course, if you ever feel that you're in a really bad situation, you're feeling hopeless, depressed, please reach out to your doctor, because that's what we're here for, and we want to help with that. And we realize this is a really hard time for everybody. So.
Yes, definitely. There is always somebody to talk to, and you guys both, mentioned that. But another big thing is, I'm not speaking for everybody, but just fresh air. I know you said that fresh air helps a lot. And now with the weather, starting to get nicer, it's a perfect time to get outside, whether you go for a walk or you just go sit outside of your house, right, or, something, just get out and change of scenery and enjoy the weather.
Yes, definitely.
Yeah. We had another question come in from Sue. She said her son works 3 days a week at Walmart, and he is outside collecting carts. Is there anything special he should do to stay safe? So I guess we can kind of make that general with all the essential workers. So at the grocery store, what can they do to stay safe? Dr. Felton?
Yeah, that's a great question. So I think hopefully Walmart and other stores are already employing a lot of precautions for the workers that are there, in terms of making sure things are wiped down and kind of thing, and encouraging hand hygiene. A situation where, the specific question about, being outdoors, it's kind of better to be outdoors than inside. But, collecting carts that people are touching, if possible, maybe to wear gloves for that situation, and being careful not to touch the face, and doing a lot of good hand hygiene would be very important. And really that's something, that all essential workers need to be careful of in their workplace. Not all situations are you allowed to wear, masks and gloves, and wearing masks and not in non-medical settings. But I think the important thing is the space, the social distancing, and the hand and not touching the face. I think we both said this multiple times.
Yeah. No, it's important. It's very important. Yeah.
Yeah.
What do you think, Dr. Schneider? Anything else on that one?
No, I think that's all. Yes, it does come down to all of those things that we keep hearing about. And I think it's encouraging. I know I hear every day about more corporations and things like that that are really embracing those recommendations from the CDC, and taking that to heart as far as how they are handling the workplace and protecting their workforce. So I think hopefully that's just going to get better over time, mitigating the risk for everybody.
Yes, definitely. I would agree with that. Let me see if we have any.
Can I say one other comment quickly?
Absolutely,
Actually,
yes.
just popped into my mind. The other thing to think about is people that are leaving the home to work is when you return home. I think it would be a good practice to perhaps consider doing some things that I've actually started doing, which is I wear the same shoes to work every day and I leave those shoes in the garage. I change my clothes. I wash my hands and change my clothes when I get home. So just some things that you do to avoid bringing germs into your house if you are leaving the house for work.
Yes, that's important. Dr. Schneider, do you have anything to add off of Dr. Felton?
Nope, I think those are all good ideas. Yeah, just think about when you're coming home, what precautions you can take to prevent bringing anything home.
Yeah. So for some people, this videoing is very new to them, or the not in-person visits, I guess. So for those people that are kind of hesitant because they want to see face-to-face, is there anything you guys can share to not necessarily explain the process, but just share, that it is easy and, that it still isn't an appointment, it's still helping, if that makes sense. I don't know, Dr. Felton, if you want to maybe explain a little bit on that?
Well, how we're handling the telemedicine visits right now, they're over the phone. We're not doing any with video.
Okay.
We move into that. And basically, people are scheduled for their appointment time. So if your appointment time is 8 a.m., at 8 a.m., I make that phone call. One thing to be mindful of is that sometimes it may come from a blocked number. And so some people have automatic things on their phone that block blocked numbers, if that makes sense. So you may need to turn that off so that you're able to receive the call. And basically, we open up the call with, very similar to a regular visit, so kind of going through the medications, checking in, and then talking about anything that they want to cover. And I mean, I've actually been able to cover a lot of ground on those visits. They're scheduled for the same time amount. It does not have to last the whole amount. So of the visits I've had have lasted the whole, visit has lasted that whole time. Other times we're done in 10 minutes. And so it's really to get all your questions answered. It's directly with your physician. It's not, anybody, like sometimes when you call the office for a question, you may only talk to the nurse. But this is an actual visit with your physician. And so you're not face to face with them, but you're still able to get all your questions answered. And so far, for me, it's gone really well and people have been satisfied. What do you think, Dr. Smith?
Yeah, I've been pleasantly surprised, I have to say. So I was a little nervous about it. I am not a tech savvy person, as everyone on this call can tell you, because I had trouble connecting even tonight. But it really has been going well. And so if you're reluctant, I would say don't be, because for me, it has. To me, like, I'm connecting with my patients. Like you said, we're making good progress. We're getting things accomplished. Mm-hmm. Yeah, we're not sitting face to face, but I think that I have been pleasantly surprised. I think it's going very well. So
that's great. And it's great that there is a way to still connect with patients.
Yeah, for sure.
Especially through this time where we are supposed to stay home. Yeah, that's great. It looks like we have a question. Are VNS battery replacement surgeries considered essential? Dr. Felton, if you want to go ahead, or whoever.
You can go ahead, Dr. Schneider.
Okay. No, so I would say that's really a discussion you have to have with your doctor, because it depends on your situation. So there's a lot of things that might cause batteries to deplete at a different rate. And so you really have to have that talk with your doctor about, okay, you know, how long are we thinking we're going to be in good shape? And is this something that's worth, you know, some type of a procedure right now, or is it not? And do you maybe need to do a face-to-face encounter just to keep a closer eye on it? So I think you got to have that talk with your actual provider who knows a little bit more about your VNS.
Right. Great. Dr. Felton, do you have anything to add to that?
No, I agree with that. I do know that in some hospital systems, they are scaling back on what are considered elective procedures, just in preparation for the hospital to receive large numbers of patients with coronavirus. And so some of it may be determined by that as well,
Okay.
that local hospital, what they're doing in terms of surgeries.
Okay, great. I'm just double checking. It looks like the rest of the questions that are left, we have already discussed. So people can still, you know, take time to ask some questions, but I guess I just want to ask both of you, is there anything that we didn't ask or touch on that you feel is important to share, you know, before we end the call?
Oh, you know what? I actually was just looking down at my desk and realizing I took a little note here today. There's an organization, so I know we're Wisconsin, but there's an organization out of Illinois called CURE, if anyone has heard of them. I think their website is cure.org. Probably you guys know that. But I did notice today, because I get their emails, that they are doing a variety of live streams for patients and families too right now. So I just am mentioning that because they're a good group, and that's something that I came across today.
No, yeah, thank you very much.
And the national, oh, go ahead.
No, I was just going to say, do you have anything?
Okay, yeah. And the National Epilepsy Foundation also has something on their website with many of the questions that we covered here, and maybe a couple others with written responses. And so hopefully this was helpful for people to sort of hear, you know, sort of our impression of this. But there's also a website that the Epilepsy Foundation that has several similar questions and responses there if you wanted to go back and read it later.
Great, yeah, that's great. There is one more question. I'm just going to read it. I heard people should not take ibuprofen and only Tylenol. Is that true? Shouldn't take ibuprofen and only Tylenol. Is that true? Do either of you have a response for that one?
I believe the official response from the people that know way more than me is still that that's not a definitive recommendation. But Dr. Felton, you can correct me if you've read anything more recently. But
yeah, I have heard that, but I agree with your response.
Yeah.
Great. And the last thing, I guess, I just want to say, we share all the Epilepsy Nationals info and all of the webinars and stuff that they do on our Facebook page. So anybody on this call that is not connected with us on Facebook, it's Epilepsy Foundation of Wisconsin, and we share all of their stuff as well, just you know, just to have more info and another resource. I don't see any other questions, so I think we will just wrap up. If anybody does have questions that for some reason got missed, or you have questions after the fact, just remember that connect@epilepsywisconsin.org email. And I just want to thank Dr. Felton and Dr. Schneider so much for being on here with us tonight. Thank you for taking the time. We really appreciate it. The last thing is we're hoping to do more educational pieces like this. You know, we've said it a lot tonight, but especially during this time, since we personally can't see our clients face to face, we just want to be another resource and help anybody that needs to. So thank you again for joining us. I hope everybody has a good evening.
Thanks. Let everyone know if you like this format, because I know we all would love to support everybody during this time. So
yes, definitely. That is one other thing I forgot to say. Yes, if you have any feedback for us, feel free to again send it to that connect@epilepsywisconsin.org email. We would really appreciate it. And we will be hopefully putting a schedule out in the near future for more of these.
Awesome.
Awesome. Thanks, everybody. Have a
Thanks,
good one.
everybody. Have a great night.
Bye.
Wash your hands.
Yeah.
Bye-bye.